All right. Welcome in. Welcome in. This is All Things Odd, and I am Dr. Natalie Phillips.
And I'm Dr. Hannah Galloway.
All right. And so we are back. Dr. Galloway is back. If you have watched our social media channels, you have seen that she has been traveling for a mission all last week. And so we're super excited that she's back because she's going to share a little bit about what she's doing, what she has been doing, and then the program that she's been working with. But before we get there, we're going to remind people about our YouTube channel. So I'm going to have Dr. Galloway talk about that real quick.
Yes, so you can see if you go to YouTube and search our business name there up in the top right, you can subscribe. And then you can get notifications when we have new episodes on Thursdays. You can also see the thumbnails a little bit better, so it's just easier to send out if you have somebody that you want to send it to.
Yeah, and they're all categorized. And so if you're looking for certain things like, I believe it is maybe hearing aids or maybe our live shows or cochlear implants or, dizziness or tinnitus, or if you want something that you don't see here that you want us to also be able to talk about and share with you guys, then let us know. And yeah, just let us know and we can kind of get everything organized and get it ready for you guys to share with you. So, with that, as I continue to share it out on some of our audiology groups that we're doing, I'm going to have Dr. Galloway talk a little bit more about what she did, but let's kind of start at the beginning. And the organization that she traveled with is called Faith in Practice. And so I know that there's a lot of different organizations that are out there. And so I wanted to just have Dr. Galloway talk about why she chose Faith in Practice as the organization to do some of the hearing missions that she's been doing.
Yes, so I actually kind of got recruited off of Facebook. So it really wasn't the organization that I found out about first. It was the person that I was traveling with. Her name's Jill, and she's also an audiologist. And so she was looking for somebody to go with her. She had a partner kind of lined up, and then something happened and they couldn't make the trip anymore. So this was in 2019, and I think it was probably November, and she was looking for somebody to go in February. It was like a week later that year. And so I ended up signing up to go with her and then learned about Faith in Practice kind of secondary. But they are a faith-based nonprofit. And so they're located in Texas and they only do medical missions to Guatemala. So it's just between Guatemala and the US. And so I think it's unique because they have a lot of employees that are Guatemalans that are on the ground and sort of know exactly where the help is needed and are better sort of at orchestrating, setting up clinic and what sites to use and things like that.
Mhm. Yeah, and I love it too because it's different also.
Mhm.
And that comes to my next question for you.
Mhm.
It's different from other hearing missions, and I've been on a couple of different hearing missions with a great organization. But Faith in Practice is different because it's a medical mission. And I really appreciate, and I think that you have too, just on the ones that you've attended. And of course, you've had to take a break because of COVID. Um, but because it's different because there's other specialties there, and I think that, it was kinda cool to see. So, talk about some of the other specialties and how it's so different from regular hearing missions.
Yeah, so we're on sort of a village team, and so we go out to the village and see patients. But if we see patients, like I saw at least two or three people I referred for a surgical consult for a tympanoplasty. So, they had a hole in their eardrum and been there for a really long time. But what's unique is that we can, refer for that and know that that procedure is going to get done, in Antigua, with a staff member from Faith and Practice that can help them or whatever. So it's really awesome that it's not just, okay, we have these hearing aids, and if these hearing aids don't work for you, that we can't help. We also had a fully stocked pharmacy, so we saw a lot of ear infections. And I even had to consult with the pharmacist a lot because it made the most sense for us to prescribe it, on the form rather than them send them to primary care and primary care look in the ear and try to determine, what medication they think is best. And so
Mhm.
it's really kind of a collaborative approach. But yeah, we had primary care, gynecology, pediatrics. There's a mobility clinic. So Gail that works with us, she is a PT by trade, but she also, she's like a jack of all trades. So she can just kind of think outside the box. And even if it's just, giving exercises to somebody to do, or she was all about replacing the rubber tips on people's canes because that makes a huge difference. You have more stability. So even just little things like that, having crutches that are the right height and work well for you.
And
And
on a daily basis too for you, like, what was it like in the morning? Like, start from the morning, like, when you
mhm,
guys first woke up. I think that you had shared that you had, either a devotional or some sort of, kinda coming together of the team, and
yep,
then, were there other you sent a picture, with wheelchairs that looked like
yeah.
they had to be put together. So, like, what is your typical day on a mission?
Yeah, so we this time we were a little bit further from the clinic site as far as where we were staying in the hotel. So it was about an hour bus ride in the morning. But when we first woke up, we met, and did like a little 15-20 minute kind of devotional together. Everybody kind of sit and reflect. And we also did announcements like what the pharmacy is out of, or, certain things that everybody needs to be aware of, what they're substituting for something, or if they need more clarity on the prescriptions or something like that. And so then we would eat breakfast at the hotel, then get on the bus. It was an hour bus ride to the clinic. And we set up in this Catholic church that we posted a picture of. So the village was called Caballo Blanco, so White Horse is the name of the village. And there's actually a picture of the little white horse when you pull in. And so then we got to the clinic site. They had patients kind of triaged at the gate. So they made sure that everybody had a mask, that everybody used hand sanitizer. And then, they kind of talked to them about what their most pressing concerns were. And since hearing was a little bit different, they actually just sent all the hearing patients straight to us. And then if they also needed to go, later to someone else, we could send them there after. So our mornings were like a whole bunch of patients sitting, waiting for us outside our little area. And so that's a little bit stressful, when you pull up and then there's already a ton of people waiting for you. But
Mhm.
people were so nice and grateful. And we kind of did it in groups. So we would, check everybody's ears. If somebody needed wax removed, we could put drops in their ears and have them wait. And then we tested until we'd get like 5 to 10 people that needed hearing aids, and then we would fit in a group. So
Mm.
our translator would sit sort of in a circle with everybody and just talk about, how to change the battery and how to clean it and, look for wax and all those kind of things.
And then do you have people on the ground after you leave from the mission that will take care or help take care of those hearing aids for those people?
Yeah, so we write a referral for them to come back next year. And so theoretically, without COVID, there should be a team there every single year in that
Mhm.
same village that can kind of help. And I told the patients too, some of the hearing aids they've had in the past were, not very resilient and analog. And so maybe if it didn't work, they just kind of like threw it away or didn't care about it anymore. So we talked about that too, that these things can be repaired. And, some of the hearing aids we brought had slim tubes. And so, things that can be replaced. So
Mhm.
we try to give them a little bit more information so that they can take care of it themselves. But people are so resourceful. It's amazing. We saw this one guy that came in and he had on a baseball cap that he had cut a hole in, and he had some sort of a hearing aid like inside of a plastic bag because it kept shorting out because of moisture. So he figured out if he like put it under his hat in this plastic bag, and then he had some sort of tubing that it was very elaborate, but where there's a will there's a way, and
Mhm.
he had something that worked. And so then he was trying to make it go further. So I think people are resourceful as far as
Mhm.
trying to fix it if that's what they have.
And it's nice to kinda go back to the same place, like you said, Faith and Practice,
Mhm.
they just do Guatemala, but it's kind of fun to or nice to go back to the same place because you might see, patients that come back to see you,
Yeah.
right?
Yeah, and the patient that you posted a picture of that's the volunteer for Faith and Practice, he was like, "Oh, I remember you. You fit this hearing aid last time," which was
Mhm.
awesome because we were in another village that was maybe an hour away.
Mhm.
But he was working for
Oh.
Faith and Practice, so he was there. And so yeah, it's kind of nice to be able to, and just to tell them that if you come back next year, we have more batteries, we have more, parts
Mhm.
and pieces. If you take care of the hearing aid, we can help you with it. So I think there's incentive too, that for people to come back that way.
How, do you know how far, like, people would travel to come see you? Like, what's
So
the
this
furthest away?
time, This time it seemed like people were more local to the area, but we traveled further from, the hotel that we stayed at. So I think maybe that was the difference. Whereas when I
I
went
see.
in 2019, people had traveled a couple of hours, but we were only 30 minutes ish from the hotel.
Mhm.
And I think it just depends on where they can set up clinic. Last time we were in public schools, but this time they didn't want to take up any public school classrooms
Mhm.
because kids are already strapped
Exactly.
for classroom time and everybody's behind. And so they didn't want to take up any of the schools. So instead, they're using churches. And so I think what brought us to that village was just this location and a big
Mhm.
church that we could use.
Yeah, yeah. And you had shared about well, we have a post if you guys want to go back and hear or about that one volunteer that you were able to fit and how happy he was and how giving he was.
Mhm.
He didn't even want to take another hearing aid, right? He wanted everybody else to go first. And so go back and
Yeah.
read that on our social medias outlets because it was really kind of special on that one
Mhm.
volunteer that you had talked about. But what is one of your favorite things about doing a mission with faith and practice?
I think they make it really easy to just show up and help people, which that's the best part of the mission, right? But you can't just go set up camp and then everybody show up. I mean, they have to plan all of the meals and, make sure that the location is good and that we have clean bathrooms to use. And so they kind of get everything done already. We know that we're going to have all of our supplies and our equipment comes in these big trunks. So there's about 6 red trunks that say audiology and they have the audiometers, the tympanometers, and they're stored, in a way that we're not concerned that they're not going to work or something like that. So
Mhm.
it really is just showing up to an empty room and then, unloading your trunks and then seeing patients. So Jill, the partner that I go with, she's gone 6 or 7 times, and so she's kind of figured out what we need and how to have sort of backup plans. We had some solar power body aids this time
Oh, cool.
that Faith and Practice had purchased. So for a patient that's, really elderly and doesn't, it's like a pocket talker, but solar powered. So you don't even have to change the batteries and they can just sit it in their window, and charge it up. So things
Mhm.
like that maybe here in my normal daily job, that's not
Mhm.
something that would have been as valuable, but that's, access for somebody.
Yeah, yeah. And so
So
then does Faith and Practice, go every year?
they do. And there's several different teams. If you're an audiologist and you're watching this, they would love to put audiologists on another team. They already have all of the equipment, but I believe that out of all of the teams that they have, there's only 2 that have audiology. So it's my team and then one other one. But they would love to be able to do it more. And the organization this time was able to provide us with more hearing aids than ever before. I don't
Mhm,
know if that's because of not going for a couple years. And so
mhm.
they had funds or they already had the hearing aids ordered or whatever. But that helped a lot because we were able to actually fit everybody that needed one, not just people that had a severe loss or something like that.
Yeah. Well, and you brought some hearing aids from our practice that were donated to us when we first
Yes.
started our practice. And so is it something that if people are watching too, they can donate
Mhm.
to that and we can keep it here and then whenever you go, take those particular hearing aids out?
Yes, and especially because what we were fitting is what I brought from our office were new hearing aids, but they were a few years old. And
Mhm.
so, parts that maybe we're getting rid of in our regular clinic, those are the parts that we're seeking, to take over there. So I think that kind of works out that when people are, aging out of things here, maybe those are the parts and pieces or accessories that we need to take
Mhm.
over there. So as long as the patients keep coming back too, we can replace the parts and pieces and they can keep their hearing aids.
Yeah, and you were taking digital hearing aids out, so they weren't just the
Yeah.
analog hearing aids that, had the little, dial or anything like that, but they
Hmm.
were digital hearing aids. You took a computer from our office to be able to program,
Yep.
so you are able to program digital hearing aids, in case people are watching this and they're thinking, "Oh, I might wanna donate my old hearing aid, to
Yeah.
have Dr. Galloway take it out on the mission."
And that was the first time that anybody had done that. But we just had the ability, and with the programmers being so minimal, I took some Widex hearing aids, and it's a USB link, so it's
Mhm,
kind of goes around the neck and then plugs into the computer, but
mhm,
it doesn't take up as much power, and it's relatively quick. But that was the big drawback, I guess I would say, to digital hearing aids is, you have to put each person's audiogram in the computer, which I didn't collect it on the computer. I collected it, on a piece of
Mhm.
paper. So put it in the computer, get it fit, explain to them what all the buttons, sound like and all of that. But we had 3 kids, and one woman who didn't have hearing on one side and just, some significant hearing loss on the other. So those patients we fit with the digital technology because we wanted it to be, the best that it
Mhm.
could possibly be. And the faith and practice hearing aids are analog hearing aids, but they use a 13 battery, so it lasts a little bit longer, and they're
Mhm.
branded faith and practice. The way that we fit them is we use CFA tubing. This was news to me. It's essentially, if you've ever ordered an ear mold and the soundboard, they can't put the tubing all the way through it and they only put it about halfway through, that's
Mhm.
CFA tubing. And then some actual like hearing protection molds that come in small, medium, and large. And then we just sort of fit that on the end of it and
Ah.
give them some of those nano clean, like the little floss that goes through it, or the bulb syringe so that you can blow moisture or whatever out of the tubing.
Mhm.
So it's kind of like a hodgepodge hearing aid fitting, but those are the things that are going to hold up a little bit better. And obviously, it's not efficient to take a mold of each patient.
Mhm.
They were doing instant mold, but those kind of crack over time, especially with the heat and the moisture in Guatemala. Even after 1 year, they
Mhm.
didn't look very good. So these are easier to clean. They're just silicone, so they can kind of be taken apart and cleaned.
Did you
But
ever think that you were in a rush? Like, as you were talking about it, because you have to you do the hearing test, and then you have to
mhm.
manually put the hearing test into the program to be able to fit the digital hearing aids. Did you ever think that there was a rush that, man, if we had a little more help, then, it could go a lot faster, even like an audiology assistant or another audiologist that could be there,
Yeah.
that as you were getting people ready, they could get it ready into the computer in order for you to fit that?
Mhm. Yeah, it definitely. And because we had 2 translators and they were helping us a lot with the
Mhm.
fitting and the counseling and everything. But they don't know how to get on NOAA and input an audio and all of that. We
Right.
also talked about that we could have like pre-fit some hearing aids with just like a moderate sloping loss or something like that, and
Mhm.
then just had to go in and tweak it. But ideally, if we had more audiologists, that would help. And I think in years past, they were limited by how many people could be on the team based on how many seats were on the bus because we all travel on like one big bus.
Yeah.
But this time there weren't as many Americans, so I think there might have been available spots on the bus, but
Mm.
I think that's kind of the holdup.
Yeah, yeah. Well, and then, I was just thinking maybe you could do, the hearing test one day, and then the fitting the next. But it's like then you think of all the people
Mhm.
that have traveled and they can't afford to
Right.
stay anywhere. So you kind of
Mhm.
have to do the testing and the fitting and the counseling on the same day, right?
Yeah, and
Because you need to allow them to go.
we decided that I think we did a group of 10, and it was like, okay, that was too many because a lot of them have, a family member with them or somebody that's learning how to use it. And then you want them to be able to take it out of their ear and put it back in and,
Yeah.
demonstrate understanding. And so we're like, okay, 10 was too many, 8 or 5, maybe tops next
Yeah.
time. So because it can just be expedited a little bit more.
Yeah. Well, and it's kind of fun because you get to make up the protocols depending on how it works for that mission, and
Yep.
it works. You're right. I mean, these people are getting fit, and they're leaving being able to hear, and that's what it's all about. So, absolutely love hearing about it. So, again, I'm going to pull up the Faith and Practice website so that we can kind of see it. But how can people, if people are like watching this and they want to help
Mhm.
out in some way, I'm going to pull up the website because there are different ways. Like even when you were on a certain team, you said the blogs are going up and the pictures are going up every
Yep.
day with the blog of what we did. You can follow
Mhm.
them, right? But then also, let's say there are local people that are here near us that want to figure out how they can help, whether it's financially, whether it is
Mhm.
helping out. Let me take this down here, helping out with donations or even getting you there because it's something that our practice has decided to continue to do, right? It's not that you're
Yep.
doing this like we're paying for you to go do this because it's so important. We believe that it's so important. So, this is basically the website of Faith and Practice. And let me take this other banner down so that you can kind of see that. But what are some of the things that you think that they would need
Yeah.
or
So if you
something
go
that you want me to pull up here?
the website, I'm sure you can, like, right in the top right, it says Give Now.
Mhm.
There's also mission pages for certain teams. So the team that I'm on is called AGO, and that's an acronym for 3 different initials. And so you can see right there, AGO Medical
Mhm.
Clinic, 751. So there are places where you can actually donate to that team. Once I commit to going next year, which I already told them that I would, they'll send out share the mission pages. And so it's an actual link that will say, support my particular trip.
Great.
The other thing is our office, yes, paid for, my flight and my program fees to go. And that's how you can just show up and help people because it's a well-oiled machine, that they put your program fees towards safe hotels and, foods that won't make you sick and things like that. So our office is, behind that too, just helping me to get there.
Awesome. Yeah. So if you go under the Give Now, you can, this is the different way that you can actually support just this organization, right? There are ways that you can, like what Dr. Galloway said, that you can help support that particular team. And then it
Mhm.
also looks like, let's say you're not in finance, you're not able to do financial support. There's ways you can share the mission out, on social
Mhm.
media, on links. If you want to have people that like email this link out and you can actually share what faith and practice is all about. And so there's lots of different
Mhm.
ways that you can kind of keep up with this. But
And if you
um,
go, right there where it says Casa de Fe,
yep.
that's like the Ronald McDonald House, essentially. So when I refer those patients for surgery, this is where they would stay, and they're offered, meals cooked for them and showers and all of that. And so that kind of helps them to
That's
recover
awesome.
after their surgery. And so when I was there, I bought some coffee, to support their cause. And I don't know if you can do that on their website or not, but next
Mhm.
year I'll definitely allow more suitcase space to bring back more coffee.
I love that. That's really cool. Yeah. So lots of different ways. Go check out this site. It is faithandpractice.org. And it will tell you all about who they are and what the organization is all about. And so we will definitely make sure that we post this in our in some of the things that we're doing here. But yeah, if you have any other questions, please send us questions that you might have for Dr. Galloway. She's planning on doing this every year. So we're hoping that we're going to be able to continue this and so glad that we're able to. But with that, we are going to end the show today, but we just wanted to catch up and let you guys know what she's doing when she takes off a week in the year to be able to go serve on a mission in Guatemala with Faith and Practice. And so if you've got any other questions or any things that you want to reach out to us, you can always reach out to us by email, phone, or on one of our social media channels. So with that, we will see you next week and have a great week.
Bye. Thank you.